Hi, good morning and good afternoon, everyone, and a very warm welcome. I appreciate you all taking time out today and join the session. Hope we all will have some good time and few key takeaways. Before we begin, I'd like to start with the introductions of my team and myself. I'm Shekhar Suklani, Head of Healthcare Digital Practice, and I'm joined by my co-speaker Archana Das, who is our payer practice lead and has wealth of experience in the payer market. And also, my co-host for the day is Ravindra Agarwal, who leads our Salesforce technology practice. Over the next 30 minutes, we'll be talking about how the future of health plan is evolving from claims to care to well-being. The intent here is to show how the health plan or other payers are relooking at the members' well-being. The focus is on empowering their care team with holistic member health information to provide personalized and contextual care. We would also showcase a short demo on holistic care management solution powered by Health Cloud technologies. We'll aim to finish this session in the next 20 minutes and then have time for the Q&A. I would like to start with talking about some of the critical healthcare trends in the payer industry. As you can see, the healthcare payer industry is going through a rapid transformation enabled by disruptive technologies. The growing patient pool across the globe is demanding the need for high quality care at a lower cost. Let's look at some of the key statistics from the leading industry sources. The global care management solutions market was valued at close to 10 billion last year and is expected to grow to 27 billion by 2025 at a CAGR of around 17%. Wow, that's an impressive growth. In fact, I won't be surprised if it exceeds even this number looking at the current COVID scenario. The senior population, that is the age group of 65 and above, the group needing the most basic personal care, will more than double over the next 20 years, reaching 80 million in US and close to half a billion in Europe by 2040. More than half of chronic members are not happy or getting adequate support from their payers. At the same time, more than 60% of members currently state that their payer communication is not individualized to their needs and is mostly centered around billing. Healthcare cost is too high today and can be reduced significantly by investing in well-being program for the members. All of this is leading to three key care trends for the payer industry, as you can see on the slide on the left. Move from a provider-driven to a patient-driven care model. Number two, shift in care delivery settings due to rising elderly population. And finally, the growth and acceptance of technology. For example, telehealth, as we all have seen, the reimbursements are already allowed by CMS in US across multiple states. The IoT devices, the care analytics, and the digital-led transformation, all leading to improved member health outcomes and reduced healthcare cost. Let's see how the payers are adopting some of these trends. Okay. Traditionally, the healthcare payer industry in US has grown through acquisitions, leading to disparate legacy systems that cannot communicate well with each other. And that's the case, in fact, across the world as well. Moreover, payers have seen using the historical claims and the utilization information to drive their care management programs. This typically leads to inaccurate risk stratification of the population cohorts, increased gaps in care, further impacts their star ratings, and also results in member dissatisfaction and higher hospitalizations in the longer run. However, we are now progressively seeing a shift towards member-centric, coordinated care ecosystem that is driving this change towards well-being and focused care. In fact, some of you who are not aware of what the star rating programs are, in US, the CMS, that is Center for Medicare and Medicaid Services, using a uses a fast 5-star quality rating system to measure the experiences the Medicare beneficiaries, that is people over 65, have with their health plan and the healthcare system. Health plans are rated, and these ratings are derived from more than 50 quality measures that includes BMI, flu, so on and so forth. Coming back, payers are focusing on implementing their member strategies around 3 key principles. Number 1, know me, or rather, know the member. Engage me, or engage with member. And delight me, or delight the member. This is helping the payers in not only improving the relationship with members, but also in driving customer satisfaction and retentions at the same time. Let's walk through the details with the use case in the next slide. Okay. In this case, we have taken a persona of Robert David. He is 66 years old and suffering from type 2 diabetic condition. His blood pressure level has not been stable and is suffering from mild hypertension. His risk level has been identified as medium by his payer based on the claims, utilization, and available system information. Based on his risk assessment, the care team has designed a wellness program for him. He was recommended a diet plan and also physical activities for at least 2 hours a day to keep his insulin level within the threshold. However, it was observed even after following the wellness programs there was not much improvement in Robert's health, and multiple claims were filed on his behalf by the providers. With current state, care team faces the following critical challenges: lack of access to real-time information to identify precise care gaps and design specific care plans for Robert. Care team spends a lot of time in reconciling disparate information about the member than actually focusing on their well-being. Legacy platforms to track care plan activities and members' health progress also not helping their cause. We'll now try to see how some of these challenges can be overcome through a well-defined desired state. In this case, we are looking at futuristic state where holistic view of members' health information is available to the care teams, right from medication adherence to allergies, to the family history, to encounter history, all the way up to social determinants of health information. As you can see, with relevant additional health information from varied sources, it was observed that Robert had now had low medication adherences and is also suffering from sleep apnea and depression. His risk level now has been identified as high by the payer, which was medium earlier. Care teams now are aware that Robert has a family history of cardiac failure. He had been admitted twice for chest pain in the past 1 year. His blood pressure level has been consistently high. This indicates that he has a high risk of getting cardiac-related diseases in future and hence needs a special care program to keep him healthy. From the identified care gaps, the care team can implement personalized next best action. For example, being a diabetic patient, it was observed that Robert had not done his hemoglobin A1C check for more than 3 months. This was detected from the integration of EHR in the lab reports, and hence care team can proactively schedule his test appointment. Moreover, they can also facilitate a ride share as he lives alone and has transportation issues as identified through his social determinants of health information. Since Robert has low medication adherences, guided notifications and reminders can also be sent by the care teams. Member information that summarizes Robert's health view will help the payer in better risk stratification, identify precise care gaps, introduce early interventions that will help the care team to keep Robert healthy. Payers are moving towards care model of the future and are trying to build the right data infrastructure for this newer model. There's a desperate need of a digital platform that can perform 3 critical functions: integrate data from various sources through interoperability and at the same time be compliant to the HIPAA, HL7 and FHIR standards. perform data quality checks on various kinds of information, whether it is real time or batch, structured or unstructured, etc. Implement analytical models for risk stratification, member stitching, noise filtering, clinical interventions, and insight generation. We need a futuristic system of engagement to showcase the 360-degree view of members' health and populate care management dashboards for care tracking, monitoring, and collaboration with members. We'll now move on to see a short demo on holistic care management solution through Health Cloud implementation.
The healthcare industry is going through a period of rapid transformation, driven by disruptive technologies and rising patient expectations. Improving the patient experience through integrated care delivery can help differentiate healthcare stakeholders in the marketplace. Today, most payer systems lack evidence-based actionable care inputs, limiting their ability to design personalized and effective care plans. This shifts the burden to patients, who must contact care coordinators frequently for care-related questions. Let's explore how Atos Syntel can help payers identify effective care gaps and define next best actions using Salesforce Health Cloud. A longitudinal patient record can be created in Health Cloud by importing data in the background, mainly from 4 different sources: claim details and policy details from payer systems. The EHR system provides clinical information like admission, discharge, and medication data, data from wearable devices, and finally, social determinants of health, such as food insecurity or social isolation. Now that a complete view of the patient is integrated with Health Cloud, the care coordinator can prioritize next best action through dashboards based on risk levels, the number of visits, and prevalent conditions. Based on the longitudinal patient record, care coordinators can precisely identify care gaps and design a care plan personalized to the patient's unique needs. The care coordinator can create the care plan activities and send notifications by email or mobile alerts. These notifications remind the patient about scheduled tasks. If the patient has a question for their care coordinator, it can be managed by Smart IVR, which integrates with Health Cloud to automatically pull up the patient's complete data from the care coordinator screen. This two-way communication channel improves adherence to care plans and helps create better health outcomes. Atos Syntel's Salesforce Health Cloud services provide a complete view of patient care plan data, leading to smarter patient health management and a connected patient experience. The results are improved patient satisfaction and retention, increased employee productivity, a reduction in hospital readmission rates, lower cost, and a move towards value-based care. As a Salesforce Platinum partner, Atos Syntel has a successful track record delivering a wide range of end-to-end services, including consulting, integration, implementation, and management. Our consulting services can help identify the right business case and create an ROI-driven roadmap. Our integration services integrate Salesforce Health Cloud with payer systems and other IT systems like EHR, quickly moving relevant patient data to Health Cloud without business disruption. We can also help you install and customize Health Cloud to meet your unique business needs. Our implementation services enable you to improve personalized and contextual patient experience. So, why partner with us? First, we have proven expertise and experience building high-impact solutions for our clients on the Salesforce platform. We also have a deep understanding of the healthcare industry, and our solutions are tailored to address the challenges you face. Finally, our global delivery model enables us to deliver solutions faster, more flexibly, and at lower cost than our competitors. If you are ready to transform the patient experience, modernize your IT landscape, and build more engaging, agile, and cost-effective solutions, contact Atos Syntel today. Visit us online at www.atossyntel.net.
Okay, we just saw how a member-centric care coordinated system can empower care teams with a unified member view, care interventions, and the next best actions. It also makes the tracking and monitoring of a member's health much easier. All of this leads to improved well-being and a personalized care experience. We'll move forward. Okay. The underlying source of driving this holistic care management solution is the longitudinal patient record that covers critical aspects of members' health information. Let's look at how payers are building the LPR or the longitudinal patient record through four main sources. First and foremost, being the information that is available within the payer system itself. For example, the member data, the demographics, the claims, the wellness information, so on and so forth. Second, being the clinical data that can be integrated from the EHR or the hospital side, that consists of the medications, conditions, the observations, the allergies, the ADT, which is the admit discharge, etc. The third is the out of hospital data that can be integrated through wearable devices such as the heart rate, blood pressure, blood reports from lab data, scans, etc. And last but not the least is social determinants of health information that consist of various key attributes like economic stability information like income levels, social behavioral context that tells us if the patient is staying lonely, his stress level, etc. The neighborhood and environmental information that consists of the transportation facility, the safety, nowadays the COVID spread, etc. The education level, and the access to primary health and healthcare, and the literacy. The holistic care management approach driven by longitudinal patient record gives payers the ability to act and engage members in their well-being through precise care gaps identification and personalized interventions based on the needs of the member. With changes in the reimbursement models, quality measurement and reporting, longitudinal patient record can also help payers in various areas that includes the population health management through early detection of diseases, discovering new risk factors, etc., and through detailed member profiling and alignment to care model cohorts. In addition, the LPR can also help in driving the clinical quality management programs and also improve the star ratings and reduce healthcare cost. We talked about the star rating earlier as well. To conclude, we are actively engaged in driving end-to-end solutions where the future belongs to all those payers who are trying to shift away from just simple management of claims to member-centric, care-coordinated system where they support well-being, prevention, and early interventions. With this, I'm coming towards the end of the discussions. I'll open the forum for any questions and we'll be happy to take. Thank you all. Yeah, so I just saw one quick question here. The first one that came in was, how do we tackle the GDPR? It's done in the same way as we do it for, let's say, the HIPAA compliance in US, similarly the GDPR compliance in the entire of Europe. We definitely take the patient consent before his information is stored and also have ability to remove the information on a need basis. And of course, any patient information that gets stored is time bound, and all of this is being taken through our systems which are compliant. Typically, we take care of the health, the genetic, and the biometric information about the patient. So that is how we take care of the GDPR regulations on the European side. And the same happens for the regulations on the US side, which consist of be it the HL7 standards or HIPAA standards, and more recently the FHIR standards that we're talking about, wherein all the information that gets exchanged between, let's say, the payer and the provider happens over the FHIR standards only. Okay.
Shekhar, there is one more interesting question on partnering with OEMs like Apple to facilitate patient support. Would you like to take that up?
Sure, and you can add Ravi and Archana. Yeah. So we do partner with tech giants like Apple, Google, and even Microsoft. So there are various discussions that happen with all of them in terms of how do we integrate the patient data. We have extensively done some pilots on the Azure platform, especially on the Microsoft side as well, so that all these platforms are now coming up with their own fire resources, be it the Microsoft or the Apple or the Amazons of the world, AWS of the world. So with leveraging their resources, we are able to make sure that the information is safe and we don't have to reinvent the wheel every time when we go for any customer engagements. You want to add something?
Right. And to add to your explanation, yes, Shekhar. And to add to that, we as on the platform, we are also integrating with a lot of health devices like your Fitbits, your Apple Watches, and all such kind of devices. Which can feed in data regarding the patient's health and
Ravi, you may want to use your phone connection, please. We are losing you. Okay. We'll wait for Ravi to come online. But yeah, what you're talking about, yes, we do integrate with various platforms, be it the Fitbits, be it the Apple Watch, and also with other solutions on the health cloud that we just talked about earlier in the demo as well. Okay.
Right. So, Shekhar, I'm back on the audio. I think there was some disruption.
Go ahead, Ravi, please.
Yes. So I'm not sure whether I was audible. So what I wanted to add on top of is we do have integrations built in with standard devices like Fitbit, Apple Watch, and all such kind of devices basically can be integrated with the Salesforce Health Cloud platform. So we have built a common integration layer through which these devices, the data coming from these devices on a regular basis from the patients can be integrated with their EHR data. Yeah.
Okay, we'll wait for another couple of minutes for any questions. Okay. I saw one more in terms of how do we access the slides. So I'll leave it to the group. They will come back to you in terms of how you can access the slides that we just showed. Team. Okay. Anything else, team? Anybody? Okay. So if there are no further questions, I'd like to thank each and everyone for joining the session. It was a pleasure. And feel free if you have any questions, we are all there and we'll be happy to revert back. Thank you all and have a nice day.